Hello and welcome. Have you ever wished for a partner who could take on the time-consuming, repetitive task so that you have more time to do more for the business? Well, you are in the right place. Today, I am thrilled to show you a brief demo of Sophia, an AI agent designed to lighten your workload, whether you are managing a team of caregivers or managing employee surveys or taking on other operational challenges. Today's example is going to be on caregiver support, but by the end of this video, you may be able to see many more applications for your company or your function. Back to caregivers. In the home healthcare industry, statistics show that there is a 65% turnover rate for caregivers driven by burnout. This is a costly situation for companies in this industry, not to mention the other ramifications. To mitigate this risk of burnout, some companies have a weekly call where they call each caregiver every week. If you have many caregivers, this can be time-consuming and also difficult to do consistently. This is where Sophia comes in, your own AI support agent designed to transform the way we care for our caregivers. In just a few steps, Sophia can take the workload off your shoulders, improve outcomes for both caregivers and their patients, and also help you comply with regulations that require companies to document caregiver feedback and also caregiver well-being initiatives. So without further ado, we are going to have a short call with Sophia to see Sophia in action, and then we are going to explore the capabilities of Sophia. So let's call Sophia. Normally, Sophia would call us, but in this case, I'm going to call Sophia quickly.
Louise Home Healthcare. This is a check-in, an initiative that is part of our caregiver support program. This will take about 5 minutes. Is this a good time to talk?
Yes, this is a good time to talk.
Thank you for confirming, Asana. I appreciate you taking the time to chat with me today. I'd like to ask you some questions to better understand how you're feeling. Let's start with the first question. On a scale of 1 to 5, how emotionally drained do you feel at the end of the day? A score of 1 means you're not at all emotionally drained. You feel refreshed and ready for work each day. A score of 5 means you're very emotionally drained. You often feel overwhelmed and struggle to find motivation. What score would you give yourself?
2.
You mentioned a score of 2, which indicates that you feel somewhat emotionally drained, but not excessively so. It's good to hear that you're not feeling overwhelmed. Let's move on to the next question. On a scale of 1 to 5, how physically tired do you feel at the end of the day? A score of 1 means you feel energized and rarely tired, while a score of 5 means you're very physically fatigued and frequently feel exhausted, even after rest. What score would you give yourself?
3.
That's all right, Asina. Let's take a moment to continue. On a scale of 1 to 5, how would you rate your sleep quality in the last week? A score of 1 means you had high quality sleep and feel well rested, while a score of 5 means you experience poor sleep and often feel tired due to insufficient or disrupted sleep. What score would you give yourself?
3. Actually, can I change? I think 3 is not. Please repeat again what the sleep question is to see if I made the right. I gave myself the right score.
Of course, Asina. The question about sleep quality is, on a scale of 1 to 5, how would you rate your sleep quality in the last week? A score of 1 means you had high quality sleep and feel well rested. A score of 5 means you experience poor sleep and often feel tired due to insufficient or disrupted sleep. Knowing this, would you like to adjust your score?
Yes, I will like to change my score to 3.
Thank you for clarifying, Asina. So you'll now rate your sleep quality as a 3. That indicates a moderate level of sleep quality. Now let's move on to the next question. On a scale of 1 to 5, have you noticed any changes in your appetite or eating habits? A score of 1 means you have a normal appetite with no significant changes, while a score of 5 means you've experienced significant changes in appetite due to stress. What score would you give yourself?
Sophia, I just see my boss calling me, so I cannot continue this conversation. Can we stop here and then pick up some other time?
I completely understand, Asina. If you need to take that call, we can pause our conversation and pick up another time. Your well-being is important, and I appreciate you taking the time to speak with me today. I will reach out again soon. Thank you for everything you do, and take care.
Thank you. All right, so we just saw Sophia navigate conversation gracefully. When I wanted to change my questions, she would work with me, and then when I needed to stop, she would also work with me, and so she would call me back, so Sophia can call me back, or if Sophia calls and a caregiver is not there, Sophia can leave a message with the phone number to call back and continue to follow up until the conversation takes place. So this is Sophia in action. Now, next, we are going to explore the capabilities of Sophia. All right. So what do you need to get this going? You need to have your caregiver contact information organized in a cloud-based database. Here, we are using Google Sheets as our database, but any cloud-based database is okay to use. Sophia would go through your database to determine who to call and when to call. As you can see here, caregivers have given their preferred contact time. And there is also a column here for employee status. So you can set business rules so that Sophia will call only employees who are active and call them only during their preferred time segment. This way, there isn't disruption to the caregivers. And so imagine you had 100 caregivers and your staff had to call them one by one. A human being would call one person at a time. So this would take a long time if you, for example, you have one person or a couple of people doing those calls. But with Sophia, Sophia can handle multiple calls at the same time. That is, Sophia can call multiple caregivers at the same time. And actually, Sophia can call the 100 caregivers in just a few minutes, assuming they were available at the same time. So no more scheduling nightmares and time wasted trying to find convenient time to call. And when Sophia calls and a caregiver is not available, Sophia will leave a message with the phone number to call back. And Sophia can also continue to follow up if needed until the check-in with the caregiver is completed. You can see that this can significantly cut down your staff workload and also cut down your costs. In fact, with Sophia, the cost per minute is around 10 cents. So 10 cents per minute for a call. Now let's recap briefly. So far, we have seen how Sophia handles calls and uses your database and business rules to determine who to call, when to call. Next, we will see how Sophia manages the information collected. So Sophia keeps track of all the calls in a database. Here again, we're using Google Sheets. You can use any cloud-based database. So Sophia is going to keep meticulous account of all the calls, and it's going to calculate the burnout risk level, and it can also display the full transcript if you want. You don't have to have a full transcript, but Sophia will summarize the call to give you a quick view, and also categorize the calls at a broad level: neutral, positive, negative, or drill down into more granular sentiment, such as these: cautious, concerned, satisfied, etc. So, and Sophia can also make recommendations to your HR director based on the call content. So if Sophia sees any high risk issue, Sophia can notify the HR director actually immediately, so that the proper support is given right away to help prevent burnout. So this is how Sophia manages the information. Now we're going to see the analysis that is done on this data. So this data is structured. Sophia structured it in a way that is easy to be consumed by business intelligence solutions such as Tableau, Google Looker Studio, Microsoft Power BI, and so forth. So here we are going to use Google Looker Studio to analyze the data. So this data is sent directly to Google Data Studio, so it is directly integrated. So next is we are going to look at the analysis that Sophia provides. So in this case, Sophia provides scorecards as well as trend analysis to give better insight to management, and also provides a cost data. So for example, in here, the average cost per call was 89 cents, and the average time per call was about 9 minutes. So 9 minutes per call costs you 89 cents. So this is really cost effective to do so. And so we have seen, so actually one piece of analysis that is not shown here is the open-ended questions. So one of the most challenging data analysis for human is analyzing large volumes of text data. So, and this happens typically with open-ended questions. So imagine all your caregivers give long answers to open-ended questions. That's going to lead to a lot of text to analyze if you want an overall analysis, actionable analysis for all 100 people. So, and this is something that, I remember back working with clients. I had a client, for example, who was doing employee surveys, and one survey had over 200 employees who responded, and I remember it took me quite a while to analyze the open-ended questions to come up with actionable recommendations. So, but with Sophia, in just a few minutes, Sophia can boil down that information and provide insightful analysis and classifies in themes, what have you, be able to make it really, really actionable. So that's one of the advantages also of using AI for data analysis. So in future videos, I will show you how to build this for yourself or for your client. Thank you for watching, and I will see you in the next video.